Good afternoon and welcome to the Midday News. I'm Shamila Pullen. Here's what we have in the bulletin. Saharan Dust clouds set to worsen air quality in Jamaica. $2.8 billion earmarked to upgrade national Gully network. And later in sports, reggae girls lose to world #1 in friendly. Now the details. Brace yourself. Jamaicans warned of intensifying Saharan dust from West Africa. A medical expert warns of respiratory irritation, urging at-risk groups to take precautions as air quality is expected to worsen. Many Jamaicans have been seeing a fog-like or dusty haze in the air over the past few days. This is caused by the annual Saharan dust plume, which is a normal weather event for this time of the year. Meteorologist Rohan Brown says the dust usually increases in June, strengthens through July, and peaks around mid-August.
We're seeing an active uptake of the dust because what's happening, you have ripples in the low atmosphere or tropical waves moving along the southern edge of the Sahara Desert. And when that happens, they generate a lot of dust. So we're having more of those tropical waves, and we're having more of those dust plumes coming off the west coast of Africa. So when we have that activity on the west coast of Africa, then we have more plumes coming across the Atlantic and into the Caribbean. So yes, more plumes are in store or in the forecast.
But pulmonologist Dr. Paul Scott says the heavier the Saharan dust concentration, the greater the impact on the respiratory system.
Here we're talking about persons who may have sinus problems. We're talking about persons who may be asthmatic. We're talking about persons who may have COPD or chronic obstructive pulmonary lung disease. We're talking about people who may have bronchiectasis, not a respiratory disorder, or any other respiratory disorders. Separate from that, it can also cause other issues in persons who don't have respiratory conditions. Sometimes it may just simply act as an irritant. So it may, cause coughing, sneezing, runny eyes, itchy skin, that kind of thing.
Dr. Scott says that while exposure to the dust can't be completely avoided, taking precautions is essential, especially for vulnerable groups.
You want to make sure that your lungs are optimal. Secondly, they may want to limit their exposure outside, especially at peak hours, which is during the daytime. They may want to wear some kind of protection. For example, the mask that we were using during COVID provides protection against the dust, so it helps to limit dust exposure. For those who have children, again, you may want to listen to the forecasting when the levels are at their highest and which days.
Both men were speaking on Beyond the Headlines Tuesday. Works Minister Robert Morgan announced that $2.8 billion is earmarked for repairs and upgrades to the National Gully network. This is an addition to critical flood management projects as the 2025 Atlantic hurricane season begins. Mr. Morgan made the announcement in the House of Representatives on Tuesday.
Gully is not one gully. It's an entire network of a drainage system that ensures that Kingston does not flood. A significant portion of the funds also will be dedicated to the North and South Gully in St. James. These improvements are not only critical to flood control, but also for public health and urban development, protecting vulnerable communities and ensuring a sustainable future for Jamaicans.
Mr. Morgan stated that the government is intensifying its focus on flood management through a series of strategic interventions.
For this financial year, some $825 million has been allocated to various activities such as river training, rehabilitation of eroded gullies, critical upgrades for the country's drainage system. These measures are aimed to safeguard communities, protect critical infrastructure. And this is part of the government's commitment to ensure that we are ready for any disaster.
The parliamentary opposition continues to raise concerns about the ballooning wage bill at the Jamaica Urban Transit Company, JUTC. Opposition spokesman on transport, Mikhail Phillips, was addressing a recent town hall meeting.
The Jamaican Urban Transit Company JUTC has faced several challenges over the years, including rising fuel costs, an aging fleet, and a drop in passenger numbers. These issues have raised concerns about the company's financial stability and operational efficiency. Opposition spokesman on transport Michael Phillips has criticized what he describes as a financial mismanagement at the state-run entity. He pointed out that the JUTC salary budget has increased by $1.8 billion, even though only 60 new employees are expected to be hired.
We are not saying that we have to lay off persons. But if the JUTC, who is running out less than 50% of the buses, is subsidized by the taxpayers of the tune of $11 billion this year, and is going to make, estimated to make a $13 billion loss.
He called on the government to increase transparency and enforce strict oversight to tackle what he called a deepening financial crisis at the company.
What we are saying is that the 8,000 operators within the KMTR, we want to build a system that both the JUTC and themselves can survive. As I said, we want to build them from the ground up. So we're going to have to go back to a franchise system. So those operators who operate as hackney carriages have to get in tune with the franchise system and join one of the franchises.
Mr. Phillips is proposing that once hackney carriages are included in a franchise system, they should be upgraded to ensure the system functions effectively.
If we're going to run a modern transport system, we have to facilitate them to get the 15-seater and the 30-seater, to move people, because our thing is not building up the transport operator alone, but it's how that we provide a modern transport system for the 1 million Jamaicans who are still dependent. Because we have to put people first. And we want to put them first, both the operators and those within that utilize it.
Antonia Atkinson, TVJ News.
Health Minister Dr. Christopher Tufton is urging private hospitals that are now registered to complete their registration immediately. Dr. Tufton was speaking during a recent visit to Omega Medical, a new private hospital in Westmoreland. Jamaica currently has 16 private hospitals operating across the island, but only 4 are officially registered with the government. Health Minister Dr. Christopher Tufton says this raises concerns about regulation and oversight.
This hospital has been registered with our standards agency, is now going through another process of re-registration, and therefore they have tried to keep up with the best practices that are required. Unfortunately, a number have not, and there are quite a number who are unregistered in some instances without making the effort to get registered, and the government thinks that this is not good. It certainly is a breach in terms of the policies of the government, and frankly we're going to have to step up the pace to try to ensure that they are registered.
Dr. Tufton noted that several factors contribute to these registration breaches, including bureaucratic delays and lack of awareness among some facility operators.
So for example, there's a shortage of personnel, which means that they have to be allowed to bring in persons with work permits, with the appropriate qualification through the medical council or the nursing council. And sometimes this process is bureaucratic, so we're going to have to work on that. There are other issues like certification of the labs and other such issues that I think the government bureaucracy has to work with the private entities to ensure that they get the standard.
Dr. Tufton says regularizing these facilities would benefit everyone.
From a policy perspective, we see health as one health, and therefore the more we have options in our society where Jamaicans, once they earn and can afford, have the option to go to a private institution, is the less pressure it places on the public system. And indeed, there are going to be cases where certain services are offered that can be more efficient, and people are willing to pay, whether they have insurance or they pay out of pocket. And this is something that we really should encourage, where we have one health. And that's a fundamental philosophy that we're big on.
To China now, where it has been revealed that some elderly people who caught COVID-19 years ago are now suffering from long-term COVID. The update comes as another variant poses a threat in parts of the world. Dwayne Anderson reports.
It's been more than 5 years since the COVID-19 pandemic, but days ago, the WHO issued a familiar but sobering warning for people to again wear masks amid a surge in COVID-19 cases globally, triggered by a new variant. Here in China, a lot of lessons have been learned from COVID-19, lessons that have improved mask-making designs.
That masks with nanofiber technology compared with normal masks, it performs better in terms of filtration and ventilation. And in terms of price, it's a little bit higher than normal masks. It costs 7 RMB yuan per mask, but you can wear it for 1 week to 2 weeks compared with normal masks. For example, you wear glasses, right? And I also wear glasses. If you wear normal masks in the winter and due to the heat, there will be some water drops on your glasses. But with that kind of mask, there wouldn't be any water drops.
In Jamaica, 7 yuan is around $130, a little above the common mask price of $50. But perhaps a more worthwhile investment for persons who will follow the latest call to wear masks again. And just as scary as the new COVID-19 variant is the ongoing issues among persons who caught COVID-19 years ago and never really recovered and are living with symptoms each day.
Take elderly people as an example. Many elder people suffer from long COVID. It's not only the COVID-19, there are many side effects. So when we provide service for them, we're not only focused on a single or targeted disease like COVID-19, there are many diseases that we have to take into account.
This company provides medical supplies to many markets in parts of Asia, but it says it is expanding its offerings to reach parts of the West, including Jamaica. Dwayne Anderson, TVJ News.
The Mandville Police Youth Club volunteered and raised funds to help 2 Manchester schools. They donated a camera system to Albion Primary to improve safety after concerns from Principal Paulette Cheddar. At Villa Road Primary, teacher Simone Bailey highlighted a decline in student interest in reading.
In terms of safety, we now have 2 campuses. We do not get funding from the government when it comes to securing our students, whether in the day and the compound in the night. Although we have 2 security guards, and this is telling too much, Mr. Morgan, we also need to supplement with cameras because they are not there 24/7. They just work 1 shift. And it's 2 campuses, and hence the camera system will be more than just a backup. It will be there 24/7 for us to monitor our children. We have students with special needs, and sometimes they do not know boundaries, and they can get into places where they should not get. And we need to be monitoring them throughout the day. And as I said, of course, intruders. We have no one there during the day to secure the compound. Although there are gates, we do not have a security guard at the gate. And hence, if we can monitor the happenings on the compounds, because remember it's 2, it will be a great asset to the school. So we're really grateful to the Police Youth Club for this initiative, and we're glad that we have benefited.
We have benefited by receiving a 50-inch television for the science classroom, which, nowadays students, they are solely affiliated with their tablets, and the TV will come in handy by helping them better upgrade their knowledge on science experiments. The smart TV goes a far way as, we can find different experiments online. It can be projected on the TV to show them, and it boosts their knowledge. It helps them a lot in learning skills.
Royal officer in the parish praised the young people's efforts.
The school, the Mandville Police Youth Club is doing what their motto say, helping to build a better Jamaica. And with the proceeds going towards the youth and to enhance education, this will help in our crime fighting strategies, because when the youths are educated and empowered, they'll keep away from a life of crime.
And it's time for a break. Stay with us, more stories when we return. Welcome back to the Midday News. And here's a preview of what's coming up in this evening's Health Report. In the next edition of the Health Report, we'll look at gallbladder cancer.
Smoking is a risk factor, so avoiding smoking would help. Patients who have a history, if your mother or father had gallbladder cancer, then it might be worthwhile to get screened, do an abdominal ultrasound to make sure you don't have it. And certainly if you have that history and you have gallstones, even if the pain is not that significant for you, it's probably better that you actually remove the gallbladder rather than just observing it.
That's the Health Report in Primetime News at 7. And now for today's healthy living tip. Maintain a healthy weight through balanced diet and exercise. Avoid smoking and limit alcohol intake. Stay hydrated and avoid high-fat processed foods. Manage conditions like obesity, diabetes, and gallstones. And get regular medical checkups, especially if you have gallbladder issues. It's now time for the Business Minute. Mayberry Group reported strong financial results for 2024. Total assets rose 9% to $63.9 billion. This growth was driven by investment securities and promissory notes. This was an improvement from the $1.5 billion loss in 2023. The loss was due to fair value changes and higher operational expenses. Mayberry says it's focused on leading the Jamaican capital markets. It is also strengthening its operations for future growth. Further afield, an unusual airplane made history Tuesday. It's the first all-electric plane to carry passengers to a commercial airport. The Better Technologies aircraft flew 45 minutes from East Hampton to JFK Airport. The company's founder, Kyle Clark, piloted the plane himself. He says the trip used only about $8 worth of electricity. Time now for the top regional and international stories.
In the region, the National Office of Disaster Services in Antigua and Barbuda says it's 90% prepared for the 2025 Atlantic hurricane season. Officials say there is strong coordination among partner agencies despite funding challenges that have affected training and equipment. With forecasts predicting 21 named storms, including 9 hurricanes, 5 of them major, the agency said the country is well positioned to respond. On the international scene, FEMA officials reported that the White House has approved disaster relief without notifying them promptly, causing delays and confusion. Normally, FEMA advises on disaster declarations and is notified immediately after the president signs off, allowing them to begin relief efforts. Recently, however, FEMA has been receiving notifications days late after states were already informed, making the agency appear slow despite lacking official authorization to act. And those were the top regional and international stories. I'm Antonia Atkinson.
Thank you, Antonia. We take another break. Sports is next.